it's really important to think about chaplains as some of the only religious professionals that many people in the United States will meet, and to think about what that means for how we train them, for what their work is, for the kinds of bigger questions about meaning and purpose that they can help to facilitate.
Welcome to Religion Unmuted, where we explore what religion sounds like with women's voices turned up. I'm your host for today, Pamela Prickett, a sociologist at the University of Amsterdam. Today, we're going to be talking about how the pandemic has impacted chaplains, as well as what chaplains are facing as related to politics in contemporary America. Our guest is Wendy Cadge. Wendy is a professor at Brandeis University in the Department of Sociology and in the Women's Gender and Sexuality Studies program. She teaches and writes about religion in the contemporary United States, especially as it relates to healthcare, immigration, and sexuality. In 2018, she launched the Chaplaincy Innovation Lab at Brandeis, which brings together chaplains, educators, and social scientists for events, projects, and conversation on chaplaincy and spiritual care. Thank you, Wendy, for joining us today.
Good to be with you.
So early in the pandemic, Wendy, you published an article in The Atlantic in which you gave what I found to be a very revealing statistic, saying that in a recent national survey, 21% of Americans reported having contact with a chaplain in the previous 2 years. And so that's a lot of Americans interacting with chaplains. So who are these chaplains, and what's the reason that so many Americans are interacting with them?
So chaplains in general are religious professionals that work outside of congregations, usually in public settings like hospitals, the military, workplaces, hospices and palliative care, colleges and universities. We have found that if you scratch the surface, you can find chaplains almost anywhere. So there is a chaplain who is stationed at a research station in Antarctica. There used to be a chaplain who traveled with the Ringling Brothers Barnum and Bailey Circus. Chaplains do a lot of quiet work in a lot of hidden places. And our research has suggested that when you ask people about whether they've had contact with chaplains, the largest fraction of people have contact with them through healthcare organizations, including hospice and palliative care. But they really are present and doing their work in a broad range of settings. Father Michael Judge, who was the first casualty in 9/11, was a Catholic priest and a chaplain with the New York Fire Department. The person who took his position is Ann Cansfield, who is a woman, not a priest, an ordained Protestant minister, queer. And I sometimes say this is what chaplains used to look like, and this is what chaplains look like today. So there's a lot of change.
Yeah, so you mentioned that chaplains are a diverse and varied group. And so I can imagine that some might use humor more often than others, and some might make their mark really in facing moments of darkness or helping people and guiding them through. So in your years of observing chaplains, and I should note for our listeners that you are one of the foremost experts in the United States on chaplains, what do you think makes for a good chaplain?
Well, before we get to what makes a good chaplain, let's think about what chaplains do. And I have a book coming out in November. It's called The Everyday Work of Chaplains, and it's based on interviews with more than 65 chaplains in Greater Boston in every place that I could find them. And there are two things that all the chaplains that I have met and interviewed do. One is work around death and end of life. And the second is, in all different ways, using all different kinds of approaches, try to help people have a bigger perspective. One chaplain described it to me as helping people remember their peripheral vision, or when they're in difficult situations, to remember the things that ground them, or the values and pieces that are important to them in decision making. So I think it's fair to assume that most chaplains help people see the bigger picture, often work around end of life. What then makes a good chaplain, from my perspective, is someone who's a good and thoughtful listener, who can create the space that someone needs, regardless of what kind of space that is, and who's able to quietly support around the edges. The other piece that's really important to mention is that professional chaplains come from a broad range of religious backgrounds, including humanists and atheists and agnostics, and they serve all. And the commitment not to proselytize and to accept people as they are, who they are, religiously, spiritually, or otherwise, is a deep part of the work. So part of what makes a good chaplain to me is someone being true to that commitment and remembering that their own spiritual or religious background, while absolutely informing the work, is very rarely really at the center of their engagement or interaction with individuals, because it's not about the chaplain, it's about the person they're trying to care for.
Mhm. That reminds me of something that I read in a recent volume that you helped co-edit called Chaplaincy and Spiritual Care in the 21st Century. And in that, you quote a spiritual director at Cleveland Clinic who said, "What people want from a chaplain is someone to see their total pain."
Mm.
And it was one of those quotes that, okay, just reading it again, it gives me goosebumps, because I started thinking about what is a person's total pain and how is our society denying it to people of different backgrounds? What is it that makes having a chaplain see that become so profound for some people?
Yeah. In healthcare, I think that it's very deeply connected to seeing the whole person. And I think we know that we live in a time when our healthcare system treats different parts of us separately. And so I think in healthcare and in the time I've spent with healthcare chaplains, they often talk about what they bring in terms of bringing wholeness, presence, and hope, which begins from a commitment to seeing the whole person. And whether that's the whole pain or the whole situation or the whole history that someone brings to wherever they are, that commitment, it's about kind of seeing someone in all of their aspects. And I think that's what I hear chaplains mean and refer to when they talk in this very broad, holistic language. And because chaplains tend to work around things that are more difficult than more joyful, it is often people's whole pain as opposed to their whole joy. Although there certainly are chaplains that meet new babies that were born and do rituals for them and other things, just probably less of their time than otherwise.
Yeah. Yeah. That brings me to another question I wanted to be sure to ask. And that you've also written that chaplains name death for individuals and organizations in our death phobic society. What does it mean? What does it look like in the years that you've spent observing chaplains to really name death?
Mhm. There are some very concrete ways that chaplains name death. They hold services for staff who die in an institution, an annual memorial service for people who have died in an institution. They hold annual memorial services for patients or residents, or depending on the circumstance, who have died. They do a lot of memorial work. I'm thinking of Hebrew Senior Life here in Boston is a elder care facility. They're a lot Jewish started, currently employs a lot of Haitians. And when there have been various acts of violence and disruption in Haiti, the chaplains have done a lot. And at one point even created a part of the chapel that was where Haitian staff could gather to remember their experiences in Haiti, to remember their loved ones, to worry or care or grieve for them. So some of the ways chaplains name death are quite formal in ceremonies and rituals. Others are very improvisational, depending on what it is that's happening around them. I think in interpersonal interactions in healthcare and otherwise, most healthcare staff don't want to talk a lot about death. And that's something that chaplains do. They name it. They can answer questions in a different way. Rather than avoiding the elephant in the room, they can try to make space to name that elephant if, in fact, someone is dying or needs to make a decision about shifting from aggressive to more comfort care measures or something like that. So I think rather than shying away from death and end of life questions and discussions, which I think is what many of us do, chaplains are trained to sit and be in those spaces and try to create the conversations, the places, the rituals, the memories about them. And then to sort of be, I think about it sometimes as the link between what is and what was, also to begin to create chains of memories or opportunities for people to remember when those that they care for have died.
And an obvious question, I think, is what does that look like over the last 2 years, 2.5 years, in light of COVID-19?
So COVID put chaplains in situations that some of them had never been in before. The most important thing I think to say first is that chaplains were able to respond as well and as quickly as they did to COVID because many of them were already in position. They already worked in healthcare organizations and in palliative care and in the military. And so there was an article early in the pandemic that had a headline about chaplains running towards the dying. And that headline gave me pause, first because chaplains don't run. That's just not what they do. But second, they weren't running towards the dying. They'd always been there. It's just that people, particularly the public, hadn't seen them. Their work is quiet. Their work is on the edges. So the work of chaplains changed in the pandemic, as it did for so many people. Some were declared or called essential workers and asked to continue to report to work in person in healthcare organizations. Others were asked to work remotely. Some of them have then subsequently been involved in all different kinds of memorial activities, as well as supporting the PTSD and other after effects of trauma that both families and healthcare providers have gone through, as well as people who themselves were ill with COVID.
Do you have any stories that illustrate that point well?
Yeah, I'm thinking about a day that we got an email from a healthcare chaplain who was really struggling with the number of people in her hospital, patients who were dying. And she was trying hard to support the staff. She was trying hard to support the families. And she called because she said, who is it that does this work of kind of constant death more often than I in healthcare? She said, it's got to be somebody in the military. So she called us and she said, do you know any military chaplains? Is there someone who could help me? And we thought it over, and we actually thought of a local military chaplain who does have this experience, and we reached out to him and he agreed to talk. And the two of them, I think, made a really important connection, both because they had different skills and experiences and because they could support one another at that moment when the military chaplain's experience was actually perhaps more relevant to what it was that this healthcare chaplain was, and who works in a community hospital isn't used to large numbers of people dying, what they're used to. So that kind of a connection, I think, was an important example of how and why chaplains can support one another, and also how they can share skills and support each other as they go through unexpected situations. Some of the more difficult work that happened later in the pandemic for chaplains was actually around questions of vaccination. And so when healthcare organizations had to decide if they would allow some staff to continue to work and apply for exemptions to the requirements to be vaccinated, chaplains were often called to be on committees who were making those decisions. And as many of them would say, we didn't learn this in seminary or rabbinical school. So the work took many forms, and those are a few examples.
That's really interesting. What do you see as the differences that across faith traditions, so Christianity, Judaism, Islam, and in your work on chaplains over the last few years and before that, are there differences or a kind of common thread regardless of religious tradition?
I mean, I tend to look for the commonalities rather than the differences because I'm inclined to think that we're all sharing some commonalities in being human. I think there are many things that all chaplains do, as we've talked about, being present, creating opportunities for peripheral vision. There are many things chaplains do that are different depending on their own religious tradition and whether they're serving someone with whom they share a religious background or tradition or they don't. So I don't know that I would say that Protestant chaplains do this and Muslim chaplains do that. I would say that chaplains learn to be very adept at code switching, which is talking to people in a language that's familiar to them. And I think of a chaplain who was raised, I think, both Protestant and Catholic, and I believe was Protestant at the moment, but would carry a rosary in his pocket and pull it out when with a Catholic patient. There's lots of examples of chaplains talking about how they pray differently with different people, depending on their religious backgrounds and the kinds of prayers that they offer. So the code switching, I think, is an essential skill of chaplains and is part of how they're able to, work with such a diverse set of people.
And do you see differences by gender?
That's a good question, and one that I don't think has been written about enough. So there are lots of examples of women who are chaplains who visit with people who are not familiar with women in religious leadership. And so particularly people of certain generations, and we could say here in Boston, for example, if they're expecting a priest and a woman comes in and says she's a chaplain, but she's not a priest. So there's a fair amount of negotiation that happens there. And women who are chaplains, as women in many professional fields, often make decisions about their appearance, if they're going to wear a clerical collar, if they're Protestant, what their name tag will say. Does it say rabbi in their name or just their name? So I think women have to make particular decisions about self-presentation that are different from those that have to be made by men. And issues of religious authority that are very gendered are just as gendered in the work of chaplains, and perhaps more so because chaplains serve many different people every day, all of whom have different assumptions, which I think is very different than if you're leading a congregation where there might be a bit more, not a lot, but a bit more homogeneity.
We see lots of headlines about declining formal religious participation in the United States. And at the same time, the term kind of Christian nationalism has started to enter the lexicon of American political discourse. And so amid these competing narratives, religion is on the decline on one side, and the US is increasingly dominated by religion on the other side. Where do chaplains fit into this? And what kind of role will chaplains play in one narrative or the other, whichever you sort of fall under?
Yeah. So I think it's fair to say that religion is changing, as it's always changing, and scholars and pundits can debate how it's changing. I think what we know about how chaplaincy is changing is that more and more people are interested in doing the work of chaplaincy. In the last 20 to 30 years, the number of theological schools that offer training specifically for chaplains, so with chaplain or spiritual care in the title, has grown significantly to coming up, I think, on a quarter to a third of theological schools. So we see that growth, which is important. We also are seeing growth in bivocationality, so in the number of religious professionals who combine different kinds of work. And chaplains are among those people. So there are full-time chaplaincy positions right now in the military, in healthcare, in some colleges and universities, certainly in palliative care and hospice. I think part of what you're asking, though, is about members of the public. And part of what I wonder is, as fewer and fewer people, I believe, are affiliated with local religious organizations, we know that a third of people under the age of 30 are not affiliated. They won't meet religious professionals or religious leaders. They won't call them in ways that their parents or grandparents may have, but they will meet them in hospital emergency rooms or in disaster response or in the military or in colleges. And so to me, it's really important to think about chaplains as some of the only religious professionals that many people in the United States will meet, and to think about what that means for how we train them, for what their work is, for the kinds of bigger questions about meaning and purpose that they can help to facilitate. The existential issues, in my view, that have brought people to religion and spirituality are no different than they ever were. They may even be more intense. And I think that that puts chaplains in an even more important role, because for many of those they serve, they're not entering a conversation that that person is already having with a religious professional. They're, I don't want to say beginning the conversation, but they're beginning it in a different place. So I see a really important and new role for chaplains as religious demographics change and religious leadership shifts. There are challenges about where you find chaplains and who pays for them. And I imagine a world in which there are business models that allow chaplains to be in the places where there is the most demand. And part of the work that I do with the Chaplains Innovation Lab is to try to imagine what that new world could look like, and then see how we might be able to bring it into the present or into reality one step at a time.
So we talked a lot about challenges that chaplains face. What are chaplains themselves excited about? The ones coming into your innovation lab, the ones that you talk to, what do they see as getting them looking forward to the next day?
Mm-hmm. There are a lot of people who are really excited to do the work of community chaplaincy or protest chaplaincy, social movement chaplaincy, people who see in this work an opportunity to stand between or to advocate for. And there are lots of different interesting examples of what that looks like and how it's done. So we see quite a lot of people interested in the work of community chaplaincy, and also of doing the work in, we might say, unusual places. So we do a lot of webinars. They're all available for free on our website. We did one about pet chaplaincy, and one of the participants works in a veterinary office. Others are available to consult and be of support. So we love to hear from people who are doing the work of chaplaincy in different and unusual ways. And there's lots and lots of resources and things I hope people would find helpful around all of these themes on the website of the Chaplaincy Innovation Lab.
I love that. It goes back full circle to how we sort of started talking in this conversation about the image that one might have of who a chaplain is, and just kind of correcting that narrative, and then also opening up space to have more conversations.
I wrote a paper a number of years ago about a memory book that was in a hospital that cares for quite a lot of premature infants and various different kinds of complex OBGYN questions. And it was a book where anyone who had lost a baby before or after birth could write a memory. Some people would return to the book every year on the anniversary of the baby's birth or the baby's death. This isn't about abortion, but it is about the spaces and ways in which the book lived in the chaplaincy department, that the chaplaincy department and the chaplains themselves created space for people to feel less alone and to remember that sadly this has happened to others. And they would leave the book with a family and they would say, some people find comfort in this book. You're welcome to look through it. You're welcome to add to it. You're welcome to just leave it there on the windowsill and not touch it at all. For some people, find this of help. So it's avoiding the political questions and going to the human ones about grief and mourning and the results of whatever it is that's happened and how chaplains can try to connect people there. And in this case, create chains of memory amongst people who will never meet and would have never known each other's stories absent this book, which I found to be a very powerful image and example of the importance of the work of spiritual care.
Absolutely. I'm thinking of some work that I've done with people who come together to perform rituals to bury abandoned babies. And so people who come have often experienced a loss themselves, a miscarriage, a stillbirth, and the realization in talking to them of how few rituals of recognized kind of grief that we have. And so I have to imagine that's also been, a source of, as you said, like this just sounds like a beautiful example of the way that chaplains do their work. You mentioned in talking about the future that there isn't really a business model for chaplaincy. And that term sort of stood out to me in this context of what does that mean? Why does there need to be a business model for this?
The question's really a simple one. Who's going to pay chaplains to do this work? And the only places that chaplains are required right now are in the military, federal prisons, and the Veterans Administration. Everywhere else chaplains work, they're there by choice and because some organizational leader or a set of community organizations or a religious group has opted to pay them to do this work. And so I worry that healthcare doesn't reimburse chaplains for their services. There is not a reliable stream of dollars to pay chaplains for what I think is the very important work that they do. And as religion perhaps changes, people are perhaps less religious, I think it could be easy to say, well, we don't need to pay the chaplain anymore. A third of Americans aren't even religious anymore. And I actually think it's the opposite, right? Because people don't have religious leaders who are local and they're facing a crisis in an emergency room. I think it's more important that you have a spiritual care provider who will ask different questions than a healthcare provider. But I don't think that that's the way that executives always think. And so I think we really have to ask hard questions about where the dollars and where the institutional infrastructure comes from or could come from to enable this important work to continue.
So let me just ask a quick follow-up. To the cynic who says, well, maybe that work should be done by a counselor or a social worker instead. What is the specific spiritual element or the specific humanistic contribution that a chaplain makes?
That's the right question. It's the $25,000 question. I think the special sauce, the special thing that chaplains do that is different from a counselor or a social worker has to do with engaging in a very comfortable way around questions of meaning. And social workers can do that, but they are often these days processing paperwork and meeting bureaucratic requirements and doing very important things, but are not sitting with people for extended periods or in crisis, sort of thinking about and working around questions of meaning. Counselors do this as well, but they tend to do it over a longer relationship, a series of appointments. Chaplains do that too, but much of the ways that chaplains do their work is as a drop-in in a 15-minute conversation. And so in the book that we wrote that came out recently, we talk about chaplains needing to have 3 sets of competencies or skills, those related to counseling, those relating to sort of organizational understanding and how to negotiate in a complex organization. But then the special sauce is that meaning making, a real kind of attention to, appreciation for, ability to engage around these questions of the human condition.
Oh, that's so good. That's got to go in there. Thank you. Thank you so much. That's it for this episode of Religion Unmuted. If you enjoyed today's episode, make sure to subscribe to, rate, and review us wherever you listen. Follow us on Twitter at RiceRPLP. And thank you to our guest, Wendy Cadge. Today's show was written by Haley Hemstreet and Rachel Schneider. Our series is produced by Through Wire Creative, Elaine Howard-Eklund, and myself. We had support from the Henry Luce Foundation and the American Academy of Religion. I'm Pamela Prickett. Until next time.